Good evening. I'm Dr. Robert Peppercorn, and this is the Medical Explorer. As a specialist in skin diseases and allergies and as host of this program, I'll take you on an exploration of the medical communities of our Northern California counties and bring you behind the scenes of medical care practices right here in our local areas. Have you been bothered by the annoying problems of a stuffy, itchy nose that just doesn't seem to go away? Or do you get sinus and ear pressure and feel chronically fatigued? Or have you had to stop exercising because of shortness of breath or wheezing? Well, you may be suffering from one of the most common medical problems that affects residents of Central and Northern California. This, of course, is the problem of allergy. Tonight, my associate, Dr. Foy Cox, will take us behind the scenes of our Skin and Allergy Medical Group office and show you actual allergy testing. Dr. Cox prepared this demonstration shortly after returning from his Air Force Reserve duty during Operation Desert Storm. Stay with us and watch as allergy testing is performed on the Medical Explorer himself. In the pharmacy corner, our neighborhood pharmacist, Bob Church, will inform us about remedies for the common problem of constipation. Hey, have you ever wondered about making the right decision for relief of this annoying problem? Well, then you'll certainly want to remain with us as we explore pharmacy issues. Tonight's program will be extremely timely and informative, and I hope that you'll stay with us for the next half hour. Before getting to our topics tonight, let's take a look at the latest medical news. Retin-A, the famed wrinkle cream, may have a new function according to a dermatologist in Tennessee. He's using it on stretch marks. The scientists suspected that Retin-A might work because of its success in treating scars. Stretch marks, like scars, form when the elastic fibers of collagen in your skin rupture and separate. As the body makes collagen to fill in the new space, the skin appears to stretch. Retin-A helps by promoting the formation of fibroblasts, cells that knit the skin back together. To test the theory, Retin-A 0.1% cream was used daily on stretch marks for 3 months. The report in the Journal of Dermatological Surgery and Oncology stated that 15 out of 16 patients had decreased appearance of their stretch marks after 3 months. Of course, many more studies will need to be done before dermatologists can recommend Retin-A for this purpose. Next in the medical news is more information on diet and your health. Cheeseburgers and hot fudge may taste great, but eating food like this too often doesn't do much for your health. The latest disease to be linked to a high-fat diet is cancer of the prostate. Doctors at the University of Utah reviewed more than 50 studies on prostate cancer. They found the highest death rate for this cancer among people who eat lots of beef, milk, pork, and eggs, all pretty high in saturated fat. They also noted that people who move from countries like Japan, where people eat relatively little fat, to the United States dramatically increased their risk of getting prostate cancer. So think about reaching for lean chicken or fish instead of burgers and replacing that hot fudge sundae with a scoop of sherbet or low-fat yogurt. The study was found in a recent issue of Urologic Clinics of North America. You know, honestly though, I don't think it would hurt to have those foods once in a while. Really, moderation is the key. My final medical news item concerns a rare disease that can attack children. Every 3 years or so, an outbreak of Kawasaki disease hits the United States. This is one of those years, this year. We don't know what causes this flu-like disease, which hits toddlers, but it can damage a child's heart and even prove fatal if left untreated. A gamma globulin shot can prevent heart damage, but only if given within the first few days after a child falls sick. Too often, doctors fail to administer it in time because the disease often looks like a severe case of the flu. Kawasaki disease begins with a high fever. Its other symptoms, pink eyes, red tongue, inflamed throat, and rashes on the hands and feet, don't appear for several days. So parents, be on the lookout for these symptoms. And if you can recognize any, rush your child to your pediatrician or family doctor. It's now time for us to visit our pharmacy corner as we learn the latest information on the world of drugs and medications from one of our area's most respected neighborhood pharmacists. Returning tonight in the pharmacy corner is registered pharmacist Bob Church from the great Medicine Shop Pharmacy in Marysville. Bob, welcome back to our show.
Thank you for that build-up.
Oh, I like it. I mean, I hear only good things, and I'm really glad you're here.
Thank you.
The subject of constipation is rarely talked about, you know, with shows like this on TV, and patients seem to be a little bit embarrassed about it. We really need to get into it a little bit and discuss these bowel irregularities because it's one of the most common problems of mankind. Could you give us your viewpoint on the problem of and perception of constipation in the United States?
Sure. I think, first of all, that we as a people perceive constipation in a way that we probably should not. A clinical definition of constipation would probably be you're constipated if you have less than 3 bowel movements in a week. However, public polls show us that 10% of the people that live in this country consider themselves constipated. And I want to use the term consider because I think that's sort of the crux of the whole thing. I don't think people really understand what constipation is. I think they understand it from the standpoint of a consumer who is constantly bombarded by advertisements on television and print and radio by people who are trying to sell products to treat constipation with the terms of regularity, and you almost see this heaven-like look on somebody's face after they've taken this product. And I think we've got the wrong idea about constipation. Many people feel that if you don't have a bowel movement every day, something's wrong, and nothing could be farther from the truth.
That's really interesting because that's absolutely true. People just aren't always the same. You know, the human body is different for everybody, and
absolutely
things vary from person to person. You know, I look on the shelf in the drugstore, and there are over, I don't know, 700, just amazing number of products available. What should somebody look at? How do they make that choice?
Well, it's very difficult, probably from two standpoints. Number one, the number of products, and also if you broke those products down into groups, you have several different types of laxative products to treat constipation with, and depending upon what your individual situation is, sort of tends to direct you into one category or another. It's interesting that probably 60% or more of the laxative products bought in the country are bought in pharmacies, which tells me a couple of things. Number one, people are looking for some advice or some knowledge when they go to buy those products. And number two, it's an opportunity for pharmacists to share their information and knowledge about those drugs with people who need to buy them. So I think that people should follow the trend and buy those products, seek that advice from pharmacists who can give them some good information before they make the purchase.
Briefly, can you tell us some differences between some of the products?
Sure. Probably the most widely used and probably least desirable would be the stimulant laxatives, the things such as Senna, Cascara, Bisacodyl, castor oil.
All available without a prescription?
All available without a prescription, and the way they work is they irritate the lining of the intestinal tract to cause increased motility of the intestinal tract and actually drive the fecal matter out of the rectum. People complain a lot of times when they use those products that they just aren't working. Well, the reason they aren't working is because many times you deplete your normal fecal mass, the fecal column, and which takes maybe 1 to 3 days to replenish that. And if you're using these products day in and day out, there really isn't much there to evacuate. And so it's not that they're not working, it's that you're overusing them, you're overstimulating your bowel.
What are some other products?
Some of the other products would be like the stool softeners, which really aren't the answer if you're already constipated.
I see.
They are for the people who don't want to become constipated, who have maybe had a problem in the past and they want to take something on a daily basis. They're very safe. All they do is allow more water to be absorbed into the stool. It becomes softer. It's easier to pass the stool.
Any others? What about the enemas people can buy?
Yeah, those are saline laxatives, and they're basically magnesium products. Magnesium citrate, milk of magnesia is one. You usually, with those products, if they're an oral preparation, you follow them with a large quantity of water. They just simply do like a mechanical stimulation of the bowel because of the increased amount of fluid within the bowel propelling the stool out. Another one is the bulk laxative, and we ought to talk about that because that's probably the safest product to use, the most reliable, the product you could use day in and day out. Those are the things like Metamucil, methylcellulose, brand products.
Those don't have long-term side effects from use,
No, they really don't.
Great. And
basically all they do is increase the mass of the stool, so that in turn elicits the response.
Very good. Very good.
Those are probably the safest.
Thank you. Bob, as usual, very, very important information, and I hope that our viewers will discuss their concerns about bowel habits with their pharmacists and physicians at their next opportunity. We look forward, Bob, to your returning to the Pharmacy Corner on future programs. Thank you very much.
Thank you.
Now, on with the Medical Explorer. It seems that many Americans are already beginning to forget about the sacrifices that many doctors and other private citizens made during Operation Desert Storm in the Middle East. I'm very proud to report tonight that my associate here at the Skin and Allergy Medical Group, Dr. Foy Cox, played an active role during this short war. Shortly after returning from his Air Force Reserve duty, I interviewed Dr. Cox about his experiences. The discussion also gave us an opportunity to demonstrate some new techniques in allergy testing. Let's take a look. We're now in our main allergy testing room here at the Skin and Allergy Medical Group. And I'm pleased today to welcome back to the Medical Explorer Dr. Foy Cox. Dr. Cox, you were on our show previously, but I think our viewers are really interested in hearing about your recent work in the military. You've been in the reserves for quite a long time and had to leave the community for a while during the big events in the Middle East. What happened?
Well, it was quite a interesting experience. I had a call early on a Sunday morning, and in January, and within 1 week, to be halfway across the country to fill in for a colleague who had been pulled overseas to a European base. And in that period of time, I managed to pack up my household goods.
So they gave you 4 or 5 days for you to get everything packed up?
That's right. That's right. Actually, the implication was to leave everything as it was and go, but I felt it was better to pack up, and I was able to do that and arrive in time in 1 week to begin my duty. And it was a very good experience. Fortunately, we had a good hospital in Fort Worth, Carswell Air Force Base, very competent people. Only 1 week before, half the medical staff and nurses and technicians all had been pulled away to go over to Germany. Wards were shut down with patients some of them having to be discharged into the community. And one of the reasons was the loss of the staffing of the hospital, but also because of anticipation of casualties coming, and space had to be made for those potential casualties.
So what the military people did is they shifted people from one location to another and gradually shifted people to Saudi Arabia.
That's right. For example, as I drove past Travis Air Force Base on the way to Texas, my colleague that I see on a monthly basis had been pulled to go overseas, actually into the theater of operations.
Interesting.
And of course, he had a replacement later on that came elsewhere from one of the reservists. So it was quite a bit of moving for everyone.
It caused quite a bit of furor around Yuba City office and Colusa office with Dr. Cox, because we had to all of a sudden compensate for all those patients that you have, and we took care of them pretty well, and things are back to normal now. We're glad to have you back.
Well, thank you.
Dr. Cox pulled a little joke on me, though, when he sent me this photograph, which was very interesting, from Saudi Arabia with George Bush, and I thought I saw your picture in there, But actually, that was just a nice, funny little story. Ha ha ha.
Yeah.
Right?
It was only there in spirit, but not in body.
Well, you had a lot of our patients wish you good wishes during that time, and we're proud that you were serving our country, and we thank you very much.
Well, thank you, and I'd like to thank everyone who's been very supportive and wished me well. It was a very big help to know that people were supporting the reservists and the people who were involved overseas, and we all appreciate it very much.
It's great. Well, you got back right in time for a major allergy season. You've been back now a few weeks. How how's it been going with patients you've been seeing for allergy and rhinitis, nose problems and sinus problems? What's it been like?
Well, it has been a very heavy load of patients who are suffering from allergies this season. And part of it has to do with the later rains that have delayed some of the symptoms, so that we're seeing a larger group now than we might normally see at this time of the year. Of course, there's always a progression of materials in the air that some individual is going to be allergic to. Right now, the trees, of course, are a major problem, and the grasses and weeds will become more important as we go further into the season.
No question about it. We've seen tremendous increase in patients the last few weeks with that problem.
That's right, and there seems to be nothing more miserable than having an allergic reaction where you can't breathe, where the life becomes miserable, tied to Kleenex boxes.
Right, which we know very well. Well, we've talked before about allergies on the program, but I'd like to go through some more modern thinking about it. A patient comes in, and we usually have the approach of trying to give people fast relief and giving them the choice of whether they would be benefited by having testing done. What's it like in a discussion with a new patient when they come in for allergies? What do you go through?
Well, I think it's always important for individuals to understand why that they're having a problem, and we pay attention to that at first to lay the groundwork for the patient to help select the therapy that is most appropriate for them. We have some individuals who know when they come in that they wish to know exactly what the materials are that they're allergic to, and they're very interested and know right off that they would like testing to find out the things that make them have symptoms. And we go into what we can test for and what we can expect from testing, and also the therapy of immunotherapy, or actually giving allergy shots that once a person's been tested that we could consider using.
But on the other hand, a patient that may want to come in who doesn't want to go through a lot of tests, you can give them a very fast treatment in different ways, too.
That's right. It depends on the style of life that a person will have. And that person may decide, I don't really care to know exactly what I'm allergic to, I just want relief. And there are medications that we can give for fast relief within the week, and also other medications by mouth or by spray that may give a more maintained relief that a person can use on a regular basis without having to have shots.
What do you think about these over-the-counter nose sprays that people start to use to try to open up their nose when they're stuffed?
Unfortunately, they're really not safe past about 2 or 3 days. The body will become a little bit used to having that material there, and then when the individual tries to use it on a long-term basis, it no longer has an effect.
Well, we're faced with that quite a bit.
And when they stop using it, their symptoms may actually get worse. So it's a bit of a two-edged sword.
So we actually at times have to get people off that almost addiction to those drugs.
That's right. That's right. And substitute other medications which can help them so that they can get some relief as well.
When talking about allergy shots, people often come in and they say they want an allergy shot to get quick relief. We want to distinguish between that particular shot and what's called immunotherapy or allergy desensitization injections over a long period of time. What's the difference?
That's right. The medicine that we would use on a short-term basis for quick relief is like Kenalog, is one brand. It's a corticosteroid that helps turn off the allergic reaction. It's not specifically putting in the material the patient is allergic to into the body. The immunotherapy, though, is a mixture of things that we have tested for that the patient is allergic to. And by slowly building up the material in the body, the person then will not react to the grass or pollen when they come in contact with it again.
So the person who wants a rapid treatment, who doesn't have a lot of time, can come in here without being tested and perhaps get one of those shots as long as they're ready to do that and there's no health reasons why they can't do that.
Right. In a healthy individual without any other contraindication to using the catalog injection, yes, we can use that without testing.
And they may get relief in a few days.
Yes, generally within 2 days they're beginning to get better, and it can have a prolonged benefit for them even out to 4 weeks.
But I know I have a few patients who will come in, more than a few, probably several hundred, who come in twice a year at the times that their allergies are kicking in. Getting the shot, it keeps them better for a few months.
That's right. It works better for those individuals who have a seasonal flare, and I think it's a good therapy for those individuals.
A lot of patients have been told that cortisone-type injections are not safe for them. And what's your feeling about that when they come in to get those?
Well, of course, we have lots of experience with not only allergies, but with poison oak reactions, of using corticosteroids for short periods of time. And that's the distinguishing factor, is that when it's a small period of time that the individual has the medication in the body, then the side effects are fewer. And in the generally healthy individual who has no other reason not to use the medication, they're very safe.
I agree with that too, and feel comfortable giving a couple of shots during the year's time if somebody really needs them to get over that bad flare-up.
That's right.
But the case where you find yourself having to give more than a few, it becomes more worthwhile to actually evaluate them more thoroughly with testing them to figure out what's causing it and perhaps getting into the allergy shot routine.
That's right. For those individuals who seem to require having a catalog injection frequently, or who haven't responded to antihistamine medications or decongestants and other therapies, then those individuals should really consider the testing so that we could use immunotherapy as a treatment for them.
Well, a lot of patients say that the doctor should really experience what they go through when they have a problem. And Dr. Cox sees me periodically sneezing around the office and with stuffy nose, so I asked him what he might do for me to help me figure out what's causing my allergies. Do you have anything in store?
Well, I think that we have some cooperative nurses who would be glad to demonstrate for you our testing procedure.
Well, I'm sure they want to get back at me for some things over the years, so let's get one of the nurses in here and let her try testing me for some allergies. Well, it's been about 8.5 years since we started the Medical Explorer program, and over the years a lot of you have said, well, Dr. Peppercorn, you've shown all these tests going on and all these surgeries and procedures. We think it's time you get involved and have some of this done to you. So I guess you get your wish today, and the nurses here are going to be happy that they're going to get to do some testing on me today. So what do you have in store, Dr. Cox?
Well, we're going to do a procedure that's called scratch testing. And this is the very first type of testing that we would do in evaluating allergies. Normally we have people lie down, but especially for you and our television viewers, we'll have you seated and only do a partial test.
Great.
So Lorraine can demonstrate this for our viewers.
There's no needles, are there, on this?
No,
one?
This is not a needle. Maybe, Lorraine, you could stand a little bit to the side.
Yeah.
Sorry.
There we go. And this is really not painful. A very superficial scratch is made. And then the test material, and we have a battery of tests to cover.
There's a box here of about 300 different things.
And we like to hold the skin sort of parallel to the floor so that the material will stay put on the scratch.
Now each bottle has got what?
It has one allergen or one material that we're testing.
So we may have
you may have grasses,
an oak tree, a maple tree,
that's right,
a pine tree.
They're very
and this is just each different tree.
They're very specific.
That's what you've got today, Lorraine, trees?
Yeah, these are trees.
Okay. Now that says control on that bottle. What is that going to mean?
That's right. Often we do the control to make sure that the person, if they don't react, the reason that they're not reacting is that they're not allergic. What can happen is someone might forget and take an antihistamine pill before testing and falsely make the other test not show up.
I guess in some people also, just the solution that the allergy material is in may cause a reaction, and this way we can see what the solution itself does.
That's another possibility. But to be scientific, we always do this control.
Call to control, yeah. So ordinarily the patient would have to be here how long to see this work out?
Well, it's going to take several minutes, and what we're waiting for is to see if there's any redness or local swelling in the tissue.
Well, since our show doesn't go that long, maybe we should see what we did earlier.
That's right. Fortunately, we did do some earlier tests, so the viewers don't have to stare at the other test sites. You can see how there's some raising of the skin and some redness around them, so that we can show that you do have some reaction to these trees.
Right, I've been allergic to trees for a long time, and around March the symptoms really get to me. Sneezing, stuffy nose, itching, and I get a Kenalog shot a couple of times a year for that too. So that's the difference. There's the before on one side and the after on the other side.
But again, this is not an uncomfortable procedure, and all of our patients tolerate it very well.
Yeah, even kids can go through this.
That's right. That's right.
And those people that are afraid of shots don't have to go through that at all when they get this done. This is just a scratch, like a paper clip rubbing against the skin.
That's right. It's really very easy to tolerate this.
Well, I guess I'm going to have to soon run out there and take an allergy pill because that's starting to itch.
We might even let you have some cream to rub on there to make it less itchy.
I think I may have to do that. But before we close, and I know our time is getting low, dermatologists always have tips for patients on different aspects of care, and I understand you prepared a little tip for our viewers today. What would you like to close with?
Well, I think it's very important getting into the sunnier season, Bob, to remind people to protect themselves from the aging effects of sun exposure by wearing a sunscreen. And generally we recommend a 15 or higher rated sunscreen. And I believe over the coming decades, people will really improve their general health and decrease their risk of skin cancer and aging effects of sunlight if they'll wear these products.
Well, it's been an interesting show today. I want to thank you for being on it, and welcome back from your military service. And I want to thank Lorraine for volunteering to show some allergy testing. And join us here again on the Medical Explorer. Bye-bye. Well, Dr. Cox has been back from his Air Force Reserve duty for quite some time now, and things have returned to normal here at our offices. I wanted to present tonight's program as a tribute not only to Dr. Cox, but also to the other medical reserve officers in our community who had to give up their medical practices to return to active military duty. Let's always remember their commitment to our country. I know that I'll never forget it. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see on this program. I'm always interested in hearing from you, and I hope that you'll suggest to your medical doctor or other healthcare professional that you'd like to see them here with me on the Medical Explorer. As you know, we're a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me here at the Skin and Allergy Medical Group of Yuba City at 350 Del Norte Avenue, Yuba City 95991. In my next program, The Medical Explorer, will take you behind the scenes of more interesting frontiers of medical care practices in Yuba City, Marysville, and Stockton. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.